Hello, everybody. My name is Guillermo Garcia-Manero from MD Anderson Cancer Center in Houston. I'm very happy to be here today at the ASH meeting in San Diego, hosting this roundtable for blood cancers today with my colleagues from New Jersey, LA, and Miami. We're going to be discussing topics related to myelodysplastic syndrome.
Hi, I'm Jamie Koprivnikar. I'm from the John Theurer Cancer Center at Hackensack University Medical Center. It's a pleasure to be here today.
I'm George Yaghmour. I'm the Associate Director of the Transplant Program at USC Los Angeles. Genuinely honored to join you today for this discussion.
I'm Sangeetha Venugopal from the Sylvester Cancer Center, University of Miami.
To complete the meeting that has been so much fun, maybe some last thoughts or wishes? So let's start with Jamie.
Absolutely. I think after taking a look at all of these abstracts, I have always been checking molecular markers, but I think I'm really going to be incorporating these molecular markers and using the MIPSS increasingly. We've really seen across a number of abstracts that this provides more accurate risk stratification for our patients. I'm really excited to have all of these options for our patients with lower risk MDS. And I think there's so much more that remains to be uncovered in terms of the disease modifying and potential anti-inflammatory effects of these agents. So I look forward to hearing more of that at future meetings, but it's an exciting time to be treating these individuals.
Any closing remarks?
Before I close, I just want to add something very important. I had comments from a lot of patients that they go 2 years under my monitoring and any treatment we offer them, and when they get to the point then they progress quickly, they always say like, I never expect my disease will progress that fast when they get to that progression. So basically paying attention to this group of patient population, also discussing with them earlier transplant or more curative option might be beneficial. Another comments before I close is venetoclax and the BCL2 inhibitor combo treatment is gonna be offer survival benefit. Okay, we are excited about better response, CR, CRI. Okay, so we're focusing on blast counts and we have more myelosuppressive effects and risk of infection. I mean, in the setting of doing transplant, does it matter? Then we talk about minimal residual disease and the role of MRD before transplant for those patient population in MDS. That's another exciting topics. To close up, it's exciting fields. Over the decades, we didn't have nothing beside erythropoietin stimulant agent. Now we have a lot of active, interesting pathway, including luspatercept and other telomerase inhibitor. And definitely, I'm so excited about this data, and we are transitioning to a better world for MDS.
Thank you, George. So for me, first of all, to thank you for your attention and for BCT for organizing this. It's a pleasure to be with my colleagues here. Yeah, I agree. We had these ESAs for 30 years, actually, when I was a fellow in, actually was a resident in the early 90s, actually. They were already the only drug that we had. So it's taken 30 years to come with new drug for our patients, but I think it's just the beginning, right? I actually, like Jamie, was very impressed by this presentation on the correlative analysis of the commands, looking at the modulation of luspatercept on the TGF-beta pathway, maybe on some of these cardiac-related molecules like the proBNP. So I think this is going to open an era of maybe in some specific targeting of these drugs. And I think we need to actually finish the job. We need to understand better what this drug does in RS-negative patients. I think the ELEMENTS trial looking at transfusion-dependent patients is going to be really important. The question that Jamie asked is, are these disease-modifying agents or not? So, because if we could show that and spare the transplant, then we'll be probably a little bit better off. And the fact that we already have like some second-generation compounds that maybe in the future could help us rescue some of these patients becoming transfusion dependent, like this KERT-050 or maybe the telomerase inhibitor. Let's not forget actually that we work very hard to develop oral hypomethylating agents that could also have a significant role there. So I think as we put these big molecular marks and we start understanding better what these MDS patients are, that we're really going to start seeing great improvements in the outcomes of our patients. So thank you very much for your attention, and thank you very much for being here.